sprouts, and raw foods to a worldwide audience. And now the host of Here's to Your Health on LA Talk Live, Joshua Lane.
We're back. This is Here's to Your Health on the LA Talk Live Broadcast Network. I'm your host, Joshua Lane. This is our Thanksgiving show. And I have Dr. Footsie with us. Dr. Footsie is a retired podiatrist who is very civic-minded and has always worked with puppets and children with wellness ideas. So, Footsie, thank you for being on my show today.
Yeah, thank you, Josh. I do appreciate the
Happy
opportunity.
to have you here. Took us a while to set up here.
Yeah, well,
but, I like your presentation. For some of my listeners who didn't catch your last performance here, you do preventative ideas for children.
Correct.
And you've done that in Los Angeles for a long time.
For probably about 20 years.
Yeah, which is very nice. And you used to have a practice as a podiatrist in, where were you in Los Angeles?
In the city of Compton.
You were in Compton?
Los Angeles County.
Compton, which is not necessarily one of our lovelier suburbs, but Compton.
People are still there, so we have to take care of them.
I completely agree with you.
So it doesn't matter where we come from.
And so now on your anti-smoking, you have, this is a puppet you made.
Well, if you want to call it a puppet, this is more like a sculpture. Okay. This is based on the answer to Joe Camel. Is my voice coming across okay?
Yes, it is.
Is it? Okay.
Yes.
And he's called Marlon Burrow. You know, he's the back-ass jackass.
Okay.
And hopefully the battery, it'll go off on it. There's some kind of a mechanism where when you walk past it, it goes on. And we have like a control. I don't know if
I can see the cigarette here.
Can you see it without kind of?
Now it's off.
Okay.
Now it's off.
Oh, now it's off. Is it on now?
Now it's on. Yeah.
Okay. And then we would use sometimes a smoke machine and blow out real smoke. You know, to give it the effect, it's like somebody smoking.
Well, I like this prop very much.
Okay. Well, he's Marlon Burrow. Okay. And so this is, because he got so bad at it that he was smoking, he hung himself. He choked to death. And this is a little box that we have here, Josh. And you can see in the front, let me see. Excuse me. We'll get this in. It says Marlon Burrow. And, of course, on the top of the box, it says mental holes, okay? And then it says smoking kills, if you can read it.
Which it does, unfortunately. Yes, it certainly does, yeah.
And this says lights out on that side. I don't know if it's coming on. And what's the back? And here's where, too much smoking, he got choked to death, okay? So this is basically...
These are very nice.
This is basically...
It's very nice.
This is a program called what we call 20 tips. Like the cigarette tips, okay, a filter on the cigarettes. And what it entails, it is, we got elementary schools to try and collect and save. And what it is, they get a little flip-top box, okay, it's flat and flip-top box. And in the box would be different things. They'd get like a bookmark. They'd get a short story book.
Kick butt.
Yeah, and this is a character called Tobacco, okay? And this is a bookmark. Not as big as this, but a little bookmark, unless it's for the Jolly Green Giant. He's reading it, okay? But anyway, so this is a large format of the bookmark, okay? And then they get a short story book, which I'd have to, it's somewhere in the pile here.
Okay, no problem.
Okay. And then they get 4 trading cards. Well, in this thing, the kids get a membership card to belong to KICK. Keep it clean with knowledge, okay? So they feel like they belong to something, so they get a membership card. So you'd put your name like Joshua when the Battle of Jericho, so that would be your name. Okay?
Sure.
Whatever, I'm just teasing, okay? In it, they also get a pledge card. I got the big, where it says, Butt Kickers Pledge. Dr. Footsie says, I shouldn't smoke. It will kill me. I pledge never to use tobacco in any form and be a member of the Butt Kicker Society in good standing. Okay? So the kids get that.
And Martin, how old are the kids you're working with when you give them these cards?
Usually second, third graders, so they'd be 7, 8. years old, give or take. We can go higher, we can go younger.
Now, you've been on the show before,
Yes,
and
sir.
you mentioned that you were once in a standing on line on a checkout counter, and one of the kids you hadn't seen for 10 years
Okay.
recognized you.
You gotta,
Which is really it's really quite a accomplishment to have a young person 10 years later say, "Oh my goodness, you helped me. I remember your information."
Right. Well, basically, what it has happened several times. It could have been either in Compton or whatever area. I'd go into a local little store, not to give a plug to 99-cent store, whatever the store might have been. I went in, and I'm looking around trying to get something, bring something back, and I remembered the time that this little kid, well, he was maybe 12, 13 years old at that time. Well, no, excuse me. He was much younger. He might have been, let's say, 8, 9 years old. So it was a few years back. But this happened several times. And he'd recognize me. Maybe I'm recognizable. Not that people want to throw things at me, but I'm recognizable. Sure. Okay. So he said, "Dr. Footsie." I said, "Okay." And looked down. "Where did I see you?" "Oh, you brought that great puppet show over to my school, to Roosevelt Elementary School." In fact, if anything, I think he might have been a kindergarten kid when we were doing stuff like that. Because he was. So I'm thinking it was about 5, 6 years after that. I said, "What'd you think?" He said, "Oh, great. We never forgot." Or I never forgot. And the idea is to impress him enough in a fun way, to get the messages across on the harmful effects of tobacco. Do you know 400,000 people will die each year to tobacco-related illnesses?
Right.
I don't care whether that's lung cancer, whether it might be, and my mind went blank now.
What, emphysema?
Thank you, emphysema. And I should make a couple of cartoons. And I was thinking about cartoons. The Fossima family, Emma and Emmett Fossima, whatever. Okay, so
that works for me.
It works for me too, I guess. Although we'd have to create some more characters. Okay, so the idea was, in a fun way, to get the message on tobacco. Being a foot doctor, and with the cartoon character was tobacco, and this is what tobacco looks like. Okay, you can see he's got the derby hat with the cigarettes in it. His toes are made like cigarettes, the big toes, cigar. So if I had to bring in the puppet, and when I say puppet, they're about 4 feet long, about 3 feet high, 2 feet wide, a little bulky.
What do you call them? Visual aids? You don't like puppets?
I don't know. It's not like a hand puppet.
They're still puppets.
Yeah, I guess if what the term puppet would mean. And we used to put up a stage, like a portable stage. And once we would do it, and would play the story and the music to my short story. And I'd either be underneath the stage or have a friend or something, and he'd be maneuvering, making the puppet go up and down the head. And then we'd work the smoke machine. And of course, the place was all dark. So you'd see all the, and you'd hear the kids, "Wow, what was that?" You know, they'd see all the smell, you know, and he'd cough, and he'd, you know, we'd go through, well, that was on the tape, you know. So that was it. And then, of course, at the end of the program, we would get kids involved with, they'd have to write a short story on what they learned on the harmful effects of tobacco, and what would you do? One kid wrote something. I kept all these things. You're talking about 15, 20 years ago. And I kept the little stories that and they were, like I said, second graders, third graders the most. And they'd write a thing, "Oh, well, tobacco, he fell asleep in bed, and he, was smoking, and all of a sudden the fire burned the whole city down." Well, I guess it could happen.
Right.
Right? Okay. So they got the message, I believe. That doesn't mean that everybody we reach is going to quit or never start smoking. We hope that you give them enough influence or enough things to work with in their head that they can say, "Hey, well, Dr. Footsie said this," or "Tobacco, I don't want to do that," or "He lost his girlfriend because he had always a smell and an odor about him, and he was breaking her heart, and he was getting sick, and he was in the hospital." So it was so the thought is there, not to say that some kids may eventually try the tobacco. And that's the sad part, because once you try it, with all the addictive stuff in it, there's so many, over 200 or over 2,000, I think, known chemicals in nicotine that can cause harm to us all. Now, I smoked as a kid. I was picking up cigarettes off the street in New York at 11 years old. And this older guy who was maybe 13, 14, forgot, we all looked up to him. He was smoking, forgot his name now. So we thought we were cool, but we were trying to take it in and inhale it or whatever. You'd be coughing your head off. And you wouldn't tell your parents you would smoke it. You thought you were cool. Until I got bar mitzvah, then my parents said, oh, okay, you're 13, you could smoke. But then, with all the thing that
Did your parents smoke too?
No, my father did, though. He smoked Camels. My sister smoked Lucky Strikes, and I smoked whatever they bought because my father worked for the government in the shipyard, so he'd buy them in those days, a carton. And I think he said a carton was $2, and I think he got 20 packs in the carton. So they were like about 10 cents or something like that.
This was in the late 50s, early 60s?
Yeah. Well, I was born in 43, so figure 13, I'd be what? 56. Yeah, thank you for your math. That's not part of that new math that they teach.
It's part of it, I think.
Oh, okay. It's not part of that Common Core.
No.
Because I'm down to the apple pit, so I don't know what I'm at now.
No problem.
Okay. So basically, and I quit on my 18th birthday. Exactly. You got to the point, it was the big cancer scare at that time, lung cancer. They were publicizing, putting it out, and me being a coward and saying, I don't want to die yet, and blah, blah, blah. I cold turkey basically quit.
So really, in essence, you responded to the information
not
that
from
the
somebody
public
else.
put out.
Oh, yeah. I don't know who put
No, I mean, you convinced yourself, but I mean, you saw it in the paper and on the news, and you decided
whatever
to act on it.
Yeah, I didn't want to yet leave. Okay?
Yeah, but that's true. And so therefore, but still, the information, you thought, well, okay, I am smoking, I hate this information, you decided you quit, which is really a very strong thing to do. And was that why, as a mature man, when you're already a graduate podiatrist, you decided that you could teach children and that you could be effective?
Well, I don't know if that's the correct way, but let me explain, make it as short as I can. After I graduated podiatry school, I was 25 years old.
Right.
Okay?
And you went to school here in L.A.?
Well, I went
San Francisco.
Yeah. I went 2 years to school in New York, in Harlem, okay, after college, this is, okay? My father worked for the shipyard, the government, and they had closed the Brooklyn Navy Yard, so he had an opportunity to come out here. My sister was living, at that time, she worked for one of the studios in L.A., or forgot what city now, okay? So he came out here and said, hey, come to California. I'm not going to go through my story, how I got lost. And so me and my mother stayed back there, and then I transferred to the school in San Francisco. At that time, there were only 5 podiatry schools. It was in New York, Philadelphia, Cleveland, Chicago, and San Francisco. Right now, I think there's about 8 or 9 schools throughout the country. Okay, one in Florida, one in Arizona, etc.
Yes, there is one in Florida.
Yeah,
Barry University.
Yeah,
right?
I've never been there. But anyway.
Actually, I've been there.
Oh, really?
Yeah.
I was in
My dad was a podiatrist.
Really?
Yeah.
Honest engine. Oh,
Yeah,
maybe
for sure,
I
yeah.
better not say honest human being.
Yeah, my dad was a podiatrist.
Really?
Uh-huh.
He's no more.
That's why I'm sympathetic to you. I understand podiatry,
He's no more with us, your father?
No, he made it to 90.
Hey,
yeah,
well,
it
hey,
was a while
I
ago.
hope I can at least make it to that, but maybe by stopping smoking, it helped me to get a little bit further.
Oh, absolutely.
A little further along. But when I got out of school and I set up practice, and without going through a long story again, I was looking about opening up in a community where there's a great need, where people were afraid to go. I mean, when I say afraid to go, where other professions, I'm going to go ahead, maybe I'll get hurt or injured.
Right.
It didn't matter to me. I was born in New York, lived with people of all colors. It didn't matter to me. Went to school in Harlem. So I said, hey, let me go where we're supposed to be, this place Watts was. So, but they wouldn't rent to me. I wound up getting to Compton, okay, by they wouldn't rent to me. Say, oh, you go up here, you go there, et cetera, et cetera. So that ended that. So when I started in Compton, after a couple of years, I started sponsoring kids in sports, build up the practice.
Sure.
Trying to, and I had an organization, still do, called Footsteps, everything with feet, right? Sports Club Inc., I-N-C. And I came up with a slogan, healthy feet, sound mind, run from drugs, a life without crime.
Good for you.
Because I had, with all the drug problems that were out there in those days,
Sure.
and I had a patient, young guy named Gus, I can't remember his last name, I knew his aunt or something. She worked at the hospital, and she made an appointment for him. And then he'd come in my office, and every time he'd come in there, he'd say, "Can I use the bathroom?" I said, "Okay, go ahead, use the bathroom." And he'd usually go in there and he'd come out, and he had like one shoe on one side. I said, "Gus, you got to have both." He said, "I didn't wash the other foot." I said, "Oh, okay." But the thing was, I found out with some of the patients, in his case, a lot of them were using the bathrooms, taking pills. What did I know?
Right.
Okay, I never was into drugs and that stuff. So when she told me that her cousin died, I started thinking, a waste of life. He was maybe at that time 25, give or take, or younger than that. And I said, there's such a big problem with running to. Why can't we humor kids and educate? When Nancy Reagan and all of them, they said, just say no. You told me just say no. I would do just the opposite, just for spite.
Right.
No, don't tell me no. I know what I could do.
Right.
I may get my tail beat afterwards,
Right.
but at least I did what I wanted to do, okay? So by doing that and making it in a fun way, by sponsoring the kids in the sports with the tiny feet, the baby feet, the footsteps, and the giant feet. We had 4 basketball teams, 2 Little League baseball teams. We might have had a flag football team. I don't remember. We had the little pom-pom girls. I was out there.
Good for you.
Okay, so we and it was colorful uniform. Kids were attracted to something different.
Right.
To have a uniform. We're proud, and it didn't look like you just put it together and just made it just to look like. You know, they felt like, ooh, we look like the Lakers. We tough. We
It's
cool.
important for kids.
Yeah, it's to build up the confidence in who you are.
Sure.
So as little by little as I was doing it, and then I got into, and this was actually, my first cartoon was developed in 1989. My mother died. She had worked she was the glue in the office there that held everything together there. And my father had died a few years before that in 82. My mother died in 86, and I went through a divorce a couple of years before that. So I was going through, but my uncle of mine had told me from back east, he'd come out to West. He says, "You ever do anything with your artwork?" I'm always doodling anyway. So I used to always doodle for the patients. I'd draw a little foot, put an eye on it, put a face on, a smile, like a happy foot. I even was sending, way back 30 some odd years ago, I developed a birthday card with my peace symbol foot. Maybe you could see it here. Okay?
Sure, I can see it.
Okay, and I put it on, put the eyes on it, whatever, and I would be, and I'd send it out to all the patients that their birthday would come up. It was a good way of marketing myself.
Sure.
And my mother would have, every time somebody'd fill the registration thing, they'd have to put their birthday. Not so much the year. I mean, they had to put the year. But if it was like November, what's today? November 26th, okay? Let's say your birthday was November 26th. Okay, so Josh's birthday. So we knew for that month, my mother had it down in by pages in a little loose leaf book. Okay, who's for November? So we'd print, I had the cards printed, wishing them a happy birthday.
Martin, unfortunately, we're running out of time on the
Oh,
interview.
okay.
How can we contact you? Because I know that you do groups. How can we contact you?
Well, easy enough to contact me is either through the website, and it's drfootsie.org, drfootsie.org. You could telephone me at 310 New Feet by letters, which is NEWFEET, or you could email me at drfootsie@drfootsie.org. Now, I've brought these programs all over.
Martin, we have to wrap up the interview. I'm going to have you back on. Maybe we'll do a holiday show with kids.
Okay. Where are we going to get the kids? We're going to bring them in here, too?
Might bring a few kids in for you.
Really?
You're listening to Here's to Your Health on the LA Talk Live Broadcast Network. I'm your host, Josh Lane. We're going to take a short break, and we'll be right back after these important messages.